Welcome back to OMFS Essentials, concise knowledge for the modern maxillofacial surgeon. The success of every surgical procedure, from the quality of wound healing to the reduction of patient morbidity, depends on the principles of infection control. Today, we move from the antiseptic methods of the past to the modern aseptic technique. First, let's define our terms. Asepsis is the practice of preparing the environment, personnel, and patient to prevent contamination. Sterilization is the procedure used on inanimate objects, like instruments and supplies, to achieve the total absence of all living microorganisms, including bacteria, spores, fungi, and viruses. We will cover the two primary categories for achieving this: physical and chemical methods. Number 1. Physical methods. Dry heat sterilization. Heat is the most reliable method of sterilization, though moist heat is generally more effective. Dry heat is essential for materials that cannot be penetrated by steam. A. Open flaming. This is a simple method of holding an instrument over a spirit flame. It is no longer practiced in modern clinical settings due to its unreliability. B. Hot air oven. This is the standard for dry heat sterilization, using an electric heater and a blower to circulate hot air and ensure a uniform temperature. Indications: it's used for items that steam cannot penetrate, such as anhydrous oils, petroleum products, talcum powder, and metallic instruments. Cycles: dry heat requires specific temperature and time cycles, such as 160 degrees Celsius for 2 hours or 170 degrees Celsius for 1 hour. Advantages: it is simple and does not corrode instruments. Disadvantages: it is time-consuming, can render sharp instruments dull and brittle, and cannot be used on rubber gloves, plastics, or PVC. Number 2. Physical methods. Moist heat sterilization. Moist heat is a more effective and efficient means of sterilization than dry heat. A. Boiling. This involves dipping instruments in boiling water at 100 degrees Celsius. Critical limitation: boiling is considered an intermediate level of disinfection, not true sterilization. It kills most vegetative microorganisms, but does not reliably kill bacterial spores. Status: in the era of HIV and hepatitis, its reliability is doubtful. Disadvantages: it is not reliable, tends to corrode instruments, and dulls sharp edges. B. Autoclaving, the method of choice. The autoclave is the gold standard for sterilization in surgery. Principle: it works on the principle of steam under pressure. By increasing the pressure, the autoclave raises the boiling point of water. Mechanism: at 15 psi, pounds per square inch, of pressure, the temperature of saturated steam rises to 121 degrees Celsius. This steam condenses on the cooler instruments, releasing a large amount of latent heat, which penetrates and kills all microorganisms, including resistant spores. Standard cycles: 121 degrees Celsius for 30 minutes, or a flash cycle, 134 degrees Celsius for 3 to 5 minutes. Critical procedure steps. Number 1. Cleaning. Instruments must be meticulously cleaned of all blood and debris prior to packaging. Number 2. Packing. Articles must be wrapped in porous materials like muslin, paper, or special pouches, and packed loosely to allow steam circulation. Number 3. Air evacuation. This is the most crucial step. All air must be allowed to escape the chamber. Trapped air is a poor conductor of heat and will create cold spots, leading to sterilization failure. Number 4. Verification. Chemical or biological indicators must be placed inside the pack to confirm that the proper temperature and time were achieved. Indications: surgical instruments, gauze, cotton, linen, gloves, and autoclavable handpieces. Contraindications: powders, oils, grease, and thermolabel materials like fiber optic cables or micromotor cords. Advantages: It is simple, economical, and highly reliable. Disadvantages: it tends to corrode instruments and dulls sharp edges. Number 3, chemical methods of sterilization. Chemical methods are used for items that cannot withstand the high heat of an autoclave or hot air oven. A. Chemiclaving. Also known as chemical vapor sterilization, this method uses a combination of formaldehyde, alcohols, acetone, ketones, and steam under pressure to sterilize. B. Cold sterilization. This involves immersing items in chemical solutions or using gas. Liquid immersion. Agents like 2% glutaraldehyde, or Sidex, are used. This is often the method for sharp instruments like scissors, blades, and suturing needles to prevent them from becoming dull. Gas sterilization, or ETO. This uses ethylene trioxide gas in a specialized chamber. It is the method of choice for delicate thermolabile items. Indications for ETO: handpieces, fiber optic cables, micromotor cords, splints, and templates. Advantages: it is the only safe method for many heat-sensitive items and does not dull sharp instruments. Disadvantages: it is not cost-effective, is time-consuming, can corrode some instruments, and chemical residues may be carried to the surgical site, causing tissue irritation. Summary: the method of sterilization is dictated entirely by the material of the instrument. Autoclave, the reliable gold standard for most items, including instruments, linens, and gauze. Hot air oven, used for items that steam cannot penetrate, such as oils, powders, and grease. Cold sterilization, chemicals or ETO, reserved for heat-sensitive items, like handpieces and fiber optic cables, and for sharp instruments to preserve their edges. Asepsis is a total commitment. From the preparation of the room to the final sterilization of the instruments, every step is a critical barrier against infection, directly impacting the healing and success of our surgical outcomes. You've been listening to OMFS Essentials. Subscribe for more concise, evidence-based episodes. And as always, keep mastering the essentials.